161. Which of the following statements regarding the use of an escort vehicle when en route to an emergency call is true? A. An escort vehicle will allow you to arrive at the scene quicker. B. To avoid getting separated from the escort vehicle, you should closely follow it. C. An escort vehicle should be used only if you are unfamiliar with the patient's location. D. With an escort vehicle, the risk of an accident at an intersection is reduced significantly. The answer is C. An escort vehicle should be used only if you are unfamiliar with the patient's location. 162. You arrive at the scene of a fall where you encounter a male patient who fell approximately 30 feet and landed on his head. He is unconscious with an open head injury and exposed brain matter. Upon identifying this patient as an organ donor, you should A. Request authorization for medical control not to initiate care. B. Manage the patient aggressively and provide rapid transport. C. Recognize that the patient's injuries disqualify him as an organ donor. D. Provide supportive care only because the patient likely will not survive. The answer is B. Manage the patient aggressively and provide rapid transport. 163. You are giving a presentation to a group of laypeople on the importance of calling EMS immediately for cardiac arrest patients. What point should you emphasize the most? A. Laypeople are incapable of providing adequate CPR. B. Rapid transport significantly reduces patient mortality. C. CPR and defibrillation are key factors in patient survival. D. Cardiac drug therapy is the most important EMS treatment. The answer is C. CPR and defibrillation are key factors in patient survival. 164. As an EMT basic, your primary responsibility is to A. Provide competent patient care. B. Ensure the safety of your partner. C. Keep yourself as safe as possible. D. Transport all patients to the hospital. The answer is C. Keep yourself as safe as possible. 165. You arrive at the scene of a traffic accident in which multiple vehicles are involved. You see at least 2 patients who appear to be unconscious. Your first action should be to A. Begin triaging the patients. B. Begin immediate patient care. C. Notify medical control for advice. D. Request an additional ambulance. The answer is D. Request an additional ambulance. 166. When providing care to multiple patients at the scene of a mass casualty incident, your goal should remain focused on A. Transporting patients to the hospital. B. Immobilizing all patients at the scene. C. Initiating CPR for those in cardiac arrest. D. Keeping all bystanders at a safe distance. The answer is A. Transporting patients to the hospital. 167. Immediately upon leaving the scene with a patient, you should A. Contact medical control. B. Notify the receiving facility. C. Advise dispatch of your status. D. Can't read the answer. The answer is C. Advise dispatch of your status. 168. When you arrive at a mass casualty incident at which other ambulances already have arrived, you should first A. Repeat the triage process. B. Report to the incident commander. C. Initiate care for the most critically injured patients. D. Obtain information from the fire service commander. The answer is B. Report to the incident commander. 169. During the triage process, which of the following injuries or conditions would classify a patient as a high priority? A. Pulselessness and apnea. B. Unilateral femur fracture and tachycardia. C. Partial thickness burns with no respiratory difficulty. D. A large avulsion to the arm and an altered mental status. The answer is D. A large avulsion to the arm and an altered mental status. 170. The role of triage officer at a mass casualty incident should be assumed by the A. Most knowledgeable EMS provider. B. EMS provider with the most years of experience. C. First EMS provider who is willing to perform the task. D. EMS medical director via telephone communication. The answer is A. Most knowledgeable EMS provider. 171. The information that would be of least pertinence when educating the public on injury prevention is A. How to provide rescue breathing. B. The proper usage of child safety seats. C. Building a child-proof fence around a pool. D. Teaching children to wear bicycle helmets. The answer is A. How to provide rescue breathing. 172. You are called to a residence for a woman in cardiac arrest. As you are initiating CPR, the patient's husband presents you with an unsigned document that states "Do not resuscitate." Your most appropriate action in this case should be to A. Stop all resuscitative efforts in accordance with the document. B. Stop CPR until the document can be validated by a physician. C. Continue CPR until you have contacted medical control for guidance. D. Contact medical control prior to beginning any resuscitation measures. The answer is C. Continue CPR until you have contacted medical control for guidance. 173. According to the United States Department of Transportation's EMT Basic National Standard Curriculum, minimum staffing for a basic life support ambulance includes A. An EMT Basic who functions as the driver. B. At least one EMT Basic in the patient compartment. C. At least two EMT Basics in the patient compartment. D. A minimum of two EMT Basics in the ambulance. The answer is B. At least one EMT Basic in the patient compartment. 174. The ultimate goal of any EMS quality improvement program should be to A. Deliver a consistently high standard of care to all patients who are encountered. B. Make sure that all personnel receive an adequate number of continuing education credits. C. Provide EMS protocols to all EMTs and hold them accountable when protocols are not adhered to. D. Provide recognition to all EMTs who have demonstrated consistency in providing competent patient care. The answer is A. Deliver a consistently high standard of care to all patients who are encountered. 175. You are caring for a 6-year-old child with a swollen, painful deformity to the left forearm. As you communicate with the parents of this child, you should A. Ask them repeatedly how the child was injured. B. Use appropriate medical terminology at all times. C. Make sure that they remain aware of what you are doing. D. Tell them that the child will be transported to the hospital. The answer is C. Make sure that they remain aware of what you are doing. 176. Following a call in which a 6-week-old infant in cardiac arrest did not survive, your partner is exhibiting significant anxiety and irritability. How can you most effectively help her? A. Allow her to voice her feelings to you. B. Tell her that she needs psychiatric help. C. Tell her to go home and get 12 hours of sleep. D. Report her behavior to the medical director. The answer is A. Allow her to voice her feelings to you. 177. When is it most appropriate to complete your pre-hospital care report for a critically ill patient? A. During the initial assessment phase. B. During the ongoing assessment phase. C. As soon as all patient care activities are completed. D. After the ambulance has been restocked at the station. The answer is C. As soon as all patient care activities are completed. 178. Which of the following scene size-up findings is least suggestive of an unsafe environment? A. A large man standing in his yard awaiting your arrival. B. Liquid draining from a car that struck a telephone pole. C. Screaming and yelling coming from inside a residence. D. The sound of breaking glass as you approach a residence. The answer is A. A large man standing in his yard awaiting your arrival. 179. Proper body mechanics when lifting and moving a patient include A. Maintaining a slight curvature of your back. B. Using the muscles of your lower back to lift. C. Keeping the weight as close to you as possible. D. Twisting at the waist when moving a patient around a corner. The answer is C. Keeping the weight as close to you as possible. 180. The immobilization device most appropriate to use for a patient with multiple injuries and unstable vital signs is A. Scoop immobilization device. B. Vest-style immobilization device. C. Short spine board immobilization device. D. Long spine board immobilization device. The answer is D. Long spine board immobilization device.